I feel so hopeless. My woman left me. I have no job. I've been stuck in this hospital for months. I want to kill myself tomorrow.
In this situation, how would the nurse respond to Connor's statement according to the guidelines? We will now have two nurses discuss about these guidelines in detail.
Do you have time to talk about some of the best practice guidelines that I would like to implement on our unit?
Absolutely. I've seen these guidelines before and I just had a few questions about them. So what do you know about these guidelines?
Well, these guidelines were developed by a panel of nurses governed by the Registered Nurses Association of Ontario. This guideline targets to provide evidence-based care to adults that are at risk for suicidal ideation and behaviors. This guideline is intended to have a potential health impact on reducing and preventing the risk for suicidal ideation and behaviors in adults who receive care from RNs and RPNs. The goal of this document is to provide the best recommendations to nurses that are evidence-based related to the assessment and management of adults at risk for suicidal ideation and behavior.
And why do we need these guidelines?
We need these guidelines because nurses need to have increased comfort, confidence, and competence in this practice area to ensure safety is enhanced for their clients and to decrease the impact of suicide in society. The guideline will focus on individuals over the age of 17 and will address the following things. It will help recognize and assess for risks of suicidal ideation and behavior. It will help with nursing interventions that lead towards the reduction of risk factors and develop strategies to promote enhanced wellness for the client and the nurse.
How are these guidelines important to family, patients, and the multidisciplinary team?
Well, these guidelines are important to registered nurses, families, physicians, and the multidisciplinary team because everyone needs to be involved in order to promote safety and prevent further suicide from occurring. This extended involvement of everyone is further expressed in the guidelines as it is recommended that nurses obtain information from all available sources. In particular, families can provide important information about the patient's mental state or behavior indicating suicidal ideation and any stressors that could be impacting them.
Do you think these guidelines will lead to improved patient outcome?
I do think that these guidelines will lead to improved patient outcomes. The guidelines are obtained from expert committee reports or opinions and or clinical experiences of respected authorities. These guidelines are done by a team of experienced nurses who have taken care of patients who have suicidal risks. This team has expertise and experience in regards to practice, education, direct nursing care, and research knowledge integrated from the hospital, the community, and the academic setting.
Do you think these guidelines are appropriate for our unit?
These guidelines are appropriate to our unit because they outline the responsibilities of the RNs and enable RNs to practice within their scope to provide evidence-based care. Moreover, we are working with adult patients with mental illnesses and often seeing too many have suicidal risks. Also, the section that focuses on practice recommendations can be adapted to any unit because the majority of the recommendations are focusing on information RNs use to build a therapeutic relationship with their patients. We should also look into educational, organizational, and policy recommendations to be better informed about the fact that RNs are not working alone and there's a system that should support the RN working with suicidal adults.
Do you think these guidelines fit within the scope of an RN?
These guidelines do fit within the scope of an RN. Here's why. Although some will be more directed to mental health or any psychiatric units, the risk of suicide exists in every setting RNs will experience on. Therefore, RNs should have the ability to critically examine the client's situation and use the best practice guidelines to provide evidence-based care. Also, within the clinical practice scope of RNs, we need to demonstrate the breadth and depth of knowledge, such as performing comprehensive assessments and direct care for adults at risk for suicidal ideation and behavior, providing information on available treatments and resources, and be able to gather valuable data and interpret complex information. The practice recommendations really focus on patient-nurse interaction through the use of therapeutic communication, targeting various areas of mental health, such as fostering hope, understanding a patient's perspectives, as well as mobilizing resources.
So what legislation, policy, or resources do you think could hinder or facilitate these guidelines?
Well, one of the pertinent resources on our units is a suicide risk assessment sheet developed by Alberta Health Services. And I have a copy here, and you can take a quick look at it, but it has some questions and some ticky boxes, as well as some more information on how to assess for suicide. It provides a framework for interviewers and RNs to develop open-ended questions in addressing the information listed in the sheet. The sheet has some useful questions such as, has there been a change to the plan to harm themselves? They also list protective factors and risk factors healthcare professionals should address and be aware of. Once completed, this assessment will be included in the patient's chart for later review. I believe this is a great tool AHS has to offer that follows some of the key guidelines, such as recognizing key indicators, assessing protective factors, and obtains collateral information from all available resources, such as family and friends.
Do you think these guidelines fit the delivery of care on our unit?
The guidelines do fit the delivery care on the unit because patients with mental health concerns may have a potential for an increased risk for suicide. The RNs on our unit perform suicide risk assessments. Therefore, the nurses can take another step of assessing in depth if they are at risk for suicide by assessing their determinants of health, suicidal ideations, and behaviors. The guidelines fit with the delivery of care on our setting as the RNs, LPNs already perform suicide assessments, but now they can further assess the risk factors. Also, the practice recommendations outline different risk factors that put the individual at risk for suicide. These practice recommendations will assist the RNs and LPNs in depth assessments of the patient's suicidal ideations and behaviors. The patient recommendations also assist the RNs and LPNs in focusing on what are risk factors that need to be assessed.
Do you think these guidelines are sustainable over time on our unit?
Yes, they can be. They meet our setting priority of assessing for suicide, and this is relevant and applicable to the population on our unit. The practice guidelines can be sustained if funding and appropriate resources are established, as they allow for in-depth assessment of relevant risk factors of suicide.
Who will be working with these guidelines?
Well, RNs and RPNs or any other healthcare professionals provide direct care to adults at risk for suicidal ideation and behavior. Higher officials who have the position of educating nurses of up-to-date practice can also work with these guidelines to develop useful resources for RNs and RPNs. It is also intended for nurses who may or may not be experts in the area of practice, who work in a variety of practice settings across the continuum of care. It is acknowledged that effective care depends on a coordinated, interdisciplinary approach incorporating ongoing communication between healthcare professionals and clients and families. Potential stakeholders could be anyone working on a psychiatric unit, including RNs, RPNs, LPNs, student nurses, physicians, unit managers, and so forth. Or in a community setting that works with suicidal individuals, such as case managers. By using this tool, stakeholders such as the unit managers and associated individuals can develop proper policies, procedures, protocols, educational programs, assessments, and documentation tools.
What do you think the best way for us would be to assess RN learning needs around these guidelines?
We definitely need to talk about the targeted healthcare professionals. We will review the guidelines with the RNs and determine what areas need improvement. Then we will really know what are the key approaches to develop necessary local context-based changes that will be effective. Conferences and educational days for RNs are examples the unit should implement where RNs share their learning and receive up-to-date nursing skills in suicidal screenings.
What do you think are some reasons that stakeholders may not actually want these guidelines?
Stakeholders have very limited funding and human resources to provide educational opportunities and develop proper procedures using the guidelines. Stakeholders may even have limited power in decision making, unfortunately. Also, limited communication between direct care providers with higher officials or decision makers leads to inadequate information or even barriers to exercise best practice guidelines.
Do you think there's any biases on the unit that could impact us implementing these guidelines?
We have seen on the units that limited funding has resulted in staff shortages. Many were called to come to work and there were a lot of nurses working overtime. We can see that the tension on the unit acts as a potential barrier to create a proper environment that supports best practice. It can create a cycle of limited staffing and overworking, which can hinder nurses' abilities to give equitable amount of attention to each patient. This in turn can negatively affect early detection of suicidal screening and ability to adapt the guidelines. The RNs on the unit have individualized approaches to screen for suicide, yet still apply appropriate knowledge and skills acquired through their nursing curriculum and ongoing professional development. They take any suicidal ideation very seriously by always following up with patients who express suicidal thoughts and behaviors. They ask questions oriented around the specificity, lethality, availability, proximity to resources that can potentiate the act. Later, detailed documentation of the event will be recorded. These can act as strengths that facilitate the adoption of the guidelines.
How do you think nurses on the unit typically hear about these guidelines?
Practice guidelines come from unit policy, emails from clinical nurse educators, and orientation and training for the practice setting is where you should learn guidelines. It is mandated by CARNA, and all RNs maintain continuing competencies and professional development. Nurses expand knowledge in practice areas by attending conferences, workshops, and by subscribing to relevant journals, newsletters, to stay up to date on current best practice guidelines and research.
Do you feel that RNs have enough resources to implement these guidelines on the unit?
If you have read the recommendations, you will see that most of it is guided around therapeutic communication and the nursing process. It may be somewhat costly to train other staff on the unit, but it would most likely be included in the orientation to the practice setting. It may add more time to staff training, and additional funding would be required for this training. If there were extra funding available, an online module could be created by IT personnel.
Aspen, what would you suggest for full-time RNs on the unit?
Collaboration with unit management to present the need for a change in the guidelines surrounding assessment of suicidal risk and ideation, using unit statistics regarding suicides to highlight the need. Informal interviews with other staff to understand their knowledge of current guidelines and how comfortable they are with current practices. Once you're able to highlight the need to implement this new guideline, it is important to provide evidence on why this is best practice and how the patients will benefit.
What do you feel is the role of the stakeholders in these guidelines? How should they be involved?
The unit, including patient care coordinators, will have to be involved. Implementing a new guideline will require staff education and a process to evaluate its efficacy. Evidence outlining the need for new guidelines would have to be presented to stakeholders. Next, a presentation revealing the evidence behind this new guideline will direct reflection with how there's a gap in practice.
How would you make a case to stakeholders about these guidelines?
A review of the evidence used in the development of the guideline would need to be presented. This review would also need to be compared to the current guideline that is being used on the unit. It may also be useful to present a comparison of statistics surrounding suicide attempts and completions between the unit in question of these guidelines and a unit practicing within these guidelines.
What would be a plan for implementing these guidelines?
The guidelines would be analyzed and adapted to the unit in question. Once relevant information is obtained, staff education modules and training would need to be implemented and completed. This would be on a pilot project basis to ensure that the guidelines are effective. After an allotted time frame, the subjective and objective evaluations by the staff and management would need to be conducted to identify the efficacy of the guideline in this context or on our unit. At this point, the data would be presented back to the stakeholders to make a decision about further implementation to other units and maybe the Calgary region wide.
How would you stay within the resources of the unit?
Well, for example, regarding time, we can create an outline of dates and deadlines that we have to meet. For example, the people that will be involved will have to identify who has consented themselves to participate in the review and such of the implementation. Also identify who actually needs extra training. As far as finances for the unit, we'll use what's available on the unit as finances, and we could probably contact Alberta Health Services and see if we have any extra finances available from there. And as far as space goes, we'll definitely just have to stay within the means of our own unit.
In your time on the unit, was there anything you saw that didn't correspond to the guidelines?
There is suicide screening on the unit, but there is a lack of continual screening for risk factors and protective factors. Many patients on our unit were only primarily screened for these factors upon admission. Also, the staff on the unit have limited time to do a thorough suicide assessment. Sometimes they are short-staffed and have a higher patient load per nurse. Therefore, they often lack the time to sit down and do a full one-on-one assessment that identifies risk factors.
In what ways can we address these guidelines on our unit?
Some major factors from the guidelines that can be tailored are: firstly, the nurse recognizes key indicators that put an individual at risk for suicidal behavior, even in the absence of expressed suicidality. For individuals who exhibit risk behaviors, the nurse conducts and documents an assessment of suicidal ideation and plan. Secondly, the nurse assesses for protective factors associated with suicide prevention. Then, the nurse obtains collateral information from all available resources: family, friends, community supports, as well as medical records and mental health professionals.
What are 2 recommendations that you would propose?
Well, the first one would be to have a systematic documentation of suicide risk assessments and obtaining collateral data, such as asking patient questions to assess protective as well as potential risk factors. Also, we should develop a blended and comprehensive clinical suicidal screening guidelines incorporating the tailored RNAO guidelines and current Alberta Health Services guidelines.
Thank you, Aspen, for your time and answering all my questions. It was really informative and you had really good ideas.
Do you have thoughts about killing yourself? Do you have thoughts of harming